By the way, it is possible for you to be pregnant and you get blood pressure because of the pregnancy. So sometimes also you can be pregnant or you have an existing blood pressure already. These are two phenomena, but they are different, but they can occur in different times. Dr. Robert, you are most welcome to Good Day TV.
Thank you so much, Mr. Kamara. I'm happy to be here. I'm happy to be here with you. Thank you so much, Good Day TV, for giving us this opportunity to talk to our people about this very serious health concern.
How is Kisubi Hospital?
Kisubi Hospital is very fine. It's on Entebbe Road, at a junction called Kauku. That's where we come from. Yes, it's a general hospital. It provides health care to everyone, mothers inclusive.
Single people and married people?
Everyone.
Or it is only for...
It's for everyone.
It does not segregate?
It does not segregate.
What makes it unique?
It's a PNFP hospital, private not-for-profit hospital. So it's a religious founded kind of institution, founded by the Catholic Church, and is currently governed by the Catholic Church, Namile Lubaga Diocese Catholic Church. So we offer our services to all Ugandans and any foreigners that is open to come to our facility.
Okay.
So I'm happy to be here with you today in this month of May, where we talk about mainly preeclampsia. We create awareness to the masses about preeclampsia. So that's the main reason I'm here today.
Excellent. Thank you so much, Dr. Robert. And for viewers who are joining us from our social media platforms, remember to go to YouTube, Facebook, Twitter, LinkedIn, TikTok, Google Data Vision Uganda. I shall be able to hear from you. You can have your comment, opinion, or any other point that you want to hear about preeclampsia or high blood pressure and pregnancy. Should you be preparing to be pregnant? Should you have become pregnant already? This is your message. Are you a man tending to make someone's daughter pregnant, or you've already made one pregnant? This is your session. Pay attention, sit down with a cup of coffee or tea since it is late. And make sure I don't eat beyond this time. Have to be drinking water. Dr. Robert,
Yes.
what's high blood pressure and pregnancy for us, the starters, in a simplest way?
Okay. So high blood pressure in pregnancy is basically elevation of someone's blood pressure. They go beyond the normal ranges. We have normal ranges. But here, blood pressure goes beyond the normal ranges, mainly in pregnant people. The second half of pregnancy, like after 20 weeks of pregnancy, those are approximately five months. So some mothers develop this kind of high blood pressure. Others tend to develop this kind of blood pressure after giving birth, like the postpartum period. So it's a serious health concern. Sometimes it's very fatal. It can lead to death, both to the death of the mother and also the baby or the fetus, because the baby is still inside the womb. So it's something that we need to create awareness about, because when we look at the statistics, the variable statistics, it's the second most cause of death in mothers after hemorrhagic emergencies, after losing blood. We have that hemorrhagic emergencies, the PPH things, where someone loses blood and they die. That's the #1 cause of death during pregnancy. The second cause of death is specifically hypertensive emergencies. And that's where preeclampsia comes about. Preeclampsia is an English term, but it basically means elevated blood pressure during pregnancy.
Wow. So how does this high blood pressure come in? Because Dr. Robert, this is my second pregnancy, you understand? The first pregnancy I was well.
Everything was okay.
Was okay. And now this child, you're telling me my blood pressure is high. What does this mean for me?
So
did my relatives bewitch me because, all that story behind?
All that story behind. So this high blood pressure in pregnancy, preeclampsia, every woman that is pregnant is at risk. Everyone is at risk. So it doesn't have any borders. It can attack any woman, provided you're pregnant. It basically stems the pathophysiology is not so clear, but it stems from the placentation, like the way the placenta attaches onto the uterus of the mother. Placenta is that other tissue that feeds the baby, that supports the fetus. So the way it implants into the womb of the mother, in case we have any abnormalities during that implantation, okay, that is what usually creates these toxins that get close to the mother's side and elevate blood pressures. Some other causes can be some modifications in the blood vessels of the mother's side, because we have a connection. This mother is it has a connection to the baby, because the mother is the one that provides all the nutrients to the baby. But during the placentation, during the attachment of the placenta onto the mother's side, we have these modifications. In case we have malimplantation of this placenta, like the placenta doesn't attach so well, a mother can get into preeclampsia or elevated blood pressures. So any mother, this can happen to any mother. Okay? Regardless. We have those that are more at risk, like people who are carrying multiple pregnancies. You're having more than one baby, you're more at risk.
But that's a blessing.
That's a blessing, but you're more at risk of developing this kind of high blood pressure. Okay? But it's generally for everyone. So we need to create awareness, because this is a very big health concern.
You talked about certain numbers of the normal blood pressure in pregnancy. When they are elevated, it's when it is qualified as preeclampsia. What are those normal levels?
So we want our blood pressures in mothers to be at least below 140 over 90. Figures that are below that. Okay, that is. But in case you come and someone starts getting pressures above 140 over 90, then we start thinking about this preeclampsia. Okay, it also comes with other elements, other symptoms, like damage to other organs, because this is blood pressure. It affects all body parts, mainly those major organs of the body. The brain, the kidneys are more at risk. The liver gets also affected. The lungs get pulmonary edema in some mothers. So, away from elevated blood pressure values, we have also to screen our organs damaged in any way or the other. So that is how we come up with this diagnosis of elevated blood pressures. So for us, as the medical workers, what we always look out for is to screen every mother. We get their baseline when they are pregnant. The moment you get pregnant like this, you're supposed to have your baseline. You visit the hospital, we get the baseline levels, that now we are starting with normal values. Your pregnancy is starting with normal values, such that we track during your subsequent kind of antenatal visits. Okay? Any mother is supposed to have those 8 visits, at least 8. So if your baseline on the first visit was normal, and we see elevation of these blood pressures, we start thinking, is this patient, is this mother developing high blood pressure in pregnancy? Such that we institute care early enough, because if most of the mothers, in case you do that early identification or early assessment, okay, and you track this blood pressure, it can be managed. It can be managed for the mother to have a healthy baby, and also the mother not to get any complications. So that assessment is always, that's what we always encourage our mothers to have whenever they are pregnant.
Excellent. Thank you so much, Dr. Robert. Colleagues and friends have just joined us. You are live on Google Data Vision, located at Makerere Gospel Church at Sapro Kagwa Road. And of course, this is Health and Beauty program that has every single Wednesday at 9 p.m. So when you just changed your screen and saw us, yes, you're talking about health. And we're focusing on the maternal and child health this very night, where we are talking about the high blood pressure in pregnancy. As a pregnant mother or as a prospective person to be pregnant, do you know your blood pressure? When did you last take your blood pressure? Do you know it is very important for you to know the figures that they have taken, not just for formality, but record them and have them and present them at every facility where you visit? very important discussion with Dr. Robert from Kisubi Hospital. Dr. Robert,
Yes.
we want
Yes.
now to talk about mostly the risk factors. A population needs to know, away from being pregnant as a risk factor, what could be other factors that are individualistic, that may be, you know.
Okay. So some of the risk factors, the main common risk factors, we see these mothers that have pre-existing kind of blood pressure. Someone already has this chronic hypertension, elevated blood pressure, they are living with it before conception, before they get pregnant. Then when you get pregnant, you're more at risk of developing preeclampsia than any other mother. So all those that are already living with hypertension, they need to be screened and also followed up to see that they don't end into preeclampsia. Then we have mothers that, in case, let's say a mother is having their second child, okay? During the first pregnancy, this mother had blood pressure or preeclampsia. Also, those mothers are prone to developing this preeclampsia again in case in the first pregnancies someone had these kind of blood pressures, okay? Then we also have cases to do with, I talked about multiple gestation, more than one baby.
Multiple children.
Multiple children, you're carrying multiple babies in your tummy, you're also prone to these kind of issues. Other conditions, basically, those are the most common ones that we look at, okay? The other issues, advanced age, we have some patients that tend to get pregnant a little bit late. So
We are
they
waiting
also
upon
have
the road,
a higher,
remember.
they also have a higher chance of developing this preeclampsia.
At what age is that?
The advanced age, any mother can get pregnant, but in case you're getting pregnant late,
What age is that?
we are not going to specify the age. Let's not specify the age for our viewers.
Okay.
So, but also that is also a risk factor to this kind of condition.
Excellent. Thank you so much, Dr. Robert. Could you please take us through a few statistics rating high blood pressure in pregnancy, maybe for the last 5 years? What has the Ministry of Health, or maybe globally, do you have any reports for people to know that this is a problem, that whatever we're sharing here is intentional, so that they can put them into practice and adhere to your advice that you're giving us tonight?
So, preeclampsia, we've talked about this high blood pressure affecting pregnant people. If we look at this available statistics globally, it's a major concern. It's more common in the blacks, sub-Saharan Africa, people where we fall. They have more of the instances of preeclampsia than the Caucasians, the white people, okay? Then we have it contributing to more mortality than any other condition apart from the hemorrhagic emergencies. It contributes to approximately 15% of death in this country, of the maternal mortality death we have in this country. More than 15% is contributed by this preeclampsia, okay, or the complications that come with preeclampsia. Then we don't have more of the data per district from the rural areas. We have mainly data from Lago, where like 5 years ago, they were tracking the incidences of at least patients that present with severe eclampsia, severe preeclampsia, those that have convulsed, because in case of the brain is affected and someone starts convulsing, that's eclampsia. Patients getting to those, at least one, they could lose at least one in 20 mothers. Okay, so it's a big burden that needs our full attention, support from all stakeholders to make sure we bring down these numbers.
Okay, excellent. Thank you so much. So the problem, colleagues and friends watching us, the problem is really big and it needs our urgent efforts to make sure we curb it down. But of course, now I want to look into the symptoms. What could be these telling factors that people could identify from a household and they maybe rush the hospital, or maybe that could give them a clue that where you are heading to is not good?
Okay. Some of the major symptoms that arise in patients with preeclampsia. Number one, headaches. They tend to get some persistent kind of headaches. You feel you have this, it's dull kind of headache, it's not going away. You've tried using some painkillers here and there, but the headache keeps persisting. You have to think about measuring your blood pressure, okay, to see is this headache from the blood pressure or it's caused by other things. Then, swelling of the feet. Mothers tend to get this swelling of the feet when they are pregnant, but there is some persistent kind of swelling of the feet, also puffiness of the face. The face also gets swollen in some mothers that develop this condition of preeclampsia. Then we have blurriness of vision. Because of the elevated blood pressures, someone will feel like their vision is blurring, like they cannot see quite well, okay? You also think about high blood pressure. Most of this, some patients that have this condition, the condition is silent. They don't have symptoms. It's just the elevated blood pressures, organ damage is going on, someone doesn't feel anything in their body. So it also tends to be silent in some patients. So that kind of assessment, that's where it comes in to help. Patients sometimes already present with the convulsions, fitting. Someone starts convulsing at home, they think it's witchcraft here and there, but it's high blood pressure causing all this, okay? So in case we see any of these danger signs during pregnancy, abdominal pain, more so in the right part of the abdomen, the right upper quadrant, like the right upper part of the abdomen, someone is getting that kind of abdominal pain. So you have to think, could I be with this kind of pressure, the preeclampsia? So any patient with these kind of symptoms, danger signs, you have to report to your service providers to assess you and assist you as fast as you can.
Excellent. Thank you so much, Dr. Robert. You've been so elaborate, and I see the reason why actually the awareness should be intensified, and we should do it immediately. Now, of course, in bid to understand the whole what you've been talking about, why do you think the awareness should be more vigorous?
The reason we should improve our awareness of this condition, that sometimes patients present to the hospital and it is already late, and the medical staff is not given that time, ample time, to help these patients. But in case we have this information disseminated to our people, they get to know the risk factors, they get to know the symptoms, the signs, and they get to have these antenatal visits done. Like you have those at least 8 antenatal visits done for every pregnant mother. We can track these numbers down. We can make sure patients, we don't lose babies to preeclampsia. We can make sure we don't lose mothers to preeclampsia. Preeclampsia happens to be the #1 cause of preterm birth, like someone delivering a baby before the term date or before time. So if we are to track down on those numbers, and most of those babies tend not to make it because they are delivered before time. So if we are to track all that and prevent those kind of incidences, we have to increase the awareness. We do this risk assessment early. Patients get to know that these things exist. It's not witchcraft. This is science. It has been researched. It's not witchcraft. We have remedies to prevent this and also help our people. So we have to pass on this information, all stakeholders, pass on this information to all our mothers, such that we reduce on the mortality rate in this country.
Excellent remarks from Dr. Robert. And of course, for viewers, I want to thank you for still watching us. And of course, I hope you are learning with us. And also, you can go ahead and be on the social media platforms, Twitter, LinkedIn, Facebook, and TikTok about this high blood pressure and pregnancy. We take a short quick break, but when we return, we shall discuss more about this topic. See you.
Good Day TV, transforming your life.
Life is a race, not against others, but for a purpose greater than yourself. Every step you take matters. Every decision you make can change the course of someone else's journey. At Makere Full Gospel Church, we are running a race too. A race to purchase land next to the church compound so as to expand our parking space and build more infrastructure for God's work. With your purchase of Run Your Race book, authored by our very own Pastor Fred Wantanti, for just 30,000 Ugandan shillings, you're not just buying a book, you're joining the race. All proceeds from the book sale will go toward purchasing the land. Together, we can build a legacy that will last for generations. Buy your copy today and let's run the race together.
Tosubwa ku Gugude TV.
Balamusiza mwenna balabi ba Gugude TV era nze abalamusako amanya nze James Eremye Jumire Mawanda nga nze omwogezi w'essiga eddamuzi. Tugenda kweyunga ku Gugude TV fenge essiga eddamuzi tuyigiriza Abannayuganda amateeka era Gugude TV yanjula programu eya minzaani kabonero kaffe nga essiga eddamuzi kwe tuteeka abantu baffe okubakakasa nti buli muntu wano mu Uganda yenkanankana ne munne kwe tubateeka ku minzaani, tewali ali wansi oba waggulu w'amateeka. Amateeka y'enkola eteekebwawo mu nsi zonna era ne mu ggwanga lyaffe Uganda, abantu bwe tulina okutambuliranga okulabika nti eddembe lyaffe ne bye tukola byonna tewaliwo alityoboola. Nze ndowooza nsonga eyo nkulu nnyo. Ebigambo ebyo tujja bisanga ku Gugude TV buli Lwakuna essaawa 9 ez'emisana. Gwetegeeza ali eyo nti tugenda kuyiga amateeka, ate bwe tumala okuyiga amateeka olwo tubeere bagezi kubanga batubuulidde. Muganda agamba nti ndi mugezi nga ki bamubuulirire. Tujja kulabagana ku olwo.
Gugude TV, transforming your life.
Once again, I want to welcome you from a short quick break, and I hope you've enjoyed the break. What have you taken? You've taken some coffee, maybe some tea, maybe some fruits or vegetables, whatever is at your disposal. And we are still talking about high blood pressure and pregnancy. We are trying to demystify different complexities around blood pressure in pregnancy and before pregnancy, and what you should do and what you should consider so that you can have a healthy baby and also protect your life as a mother and a couple. And of course, at this very important time, we want to look into the complications. Most of the times is that we ignore such things and they end up being so serious. So when we come to complications, Dr. Robert, what should we expect?
So these
And
complications.
what are complications? First of all, what's a complication?
A complication is like a bad outcome from any condition. Now, for this elevated blood pressure in pregnancy, it has some complications both to the mother and the baby.
Okay.
So, to the mother's side, this blood pressure we've seen, it can affect all organs of her system. It can affect the brain, where some patients present with those fits, convulsions. Then it can affect the kidneys. This one is mainly affected in most of the mothers, that a mother can even end up having dialysis done because the kidneys have crushed. It can affect their liver. The liver enzymes get elevated. It can affect the lungs. They get into respiratory distress. Things like that, they mainly affect this mother. The mother can also, they can also get issues inside the uterus where the placenta gets detached before time. Like you want this placenta most of the times, after delivering the baby, that's when the placenta is supposed to be delivered. But in some mothers who have this kind of blood pressure, they are at risk of developing placenta abruption, like the placenta separates before time, leading to complications to the baby, like they can end up bleeding a lot, losing a lot of blood, the patients themselves, or the baby losing their babies, okay? Then in a case where someone is living with this elevated blood pressure for quite some time, even the growth of the baby will be impaired. This baby will not develop so well. It also can also lead to death of these babies inside the womb before delivery. So that high blood pressure is the number one cause of those perinatal kind of death, like death before the delivery time. Then also, it can lead, like we've talked about the growth restriction, the baby is not developing as expected, but also we can lose these babies because of the elevated blood pressures, okay? So with all that kind of information, we need to assess. We encourage assessment, awareness, such that when the body is talking to you, you see you're getting, your feet is swelling so much, you're getting these headaches, you have to get into a healthy facility and you get assessed before things go south.
I wanted us to go to the prevention part. You've talked about complications, but you know, we lead to complications because of maybe the society has lots of information that could be myths or misconceptions. What do you think about them?
So the way this condition develops, we've talked about it, like some patients can lose their pregnancy. In our community, the African background, in case we have any other family members involved, they first think about witchcraft, okay? That I lost the pregnancy because of my co-wife, things like that. But this blood pressure can cause these issues. It can cause this, can lead to death of the baby without any witchcraft involved, okay? A patient can come with convulsions, like someone who has epilepsy. You see someone is convulsing, they are biting their tongue, they are frothing the mouth. All that, our background, the African society, we attribute such issues to witchcraft. But preeclampsia alone can give you all those complications, okay? So our patients need to be given this information. During antenatal classes, during antenatal visits, you talk to your MSAO, you talk to that health provider that is taking care of your pregnancy to get this information early. That in case I see my pregnant woman convulsing at home, fitting, what should I do? Okay, is it witchcraft? In case I come and I do this ultrasound scan and they are telling me the baby is not alive, what should I do? Is it still witchcraft? So this blood pressure, it has shown that it is very dangerous. It can clear anyone, whether rich, whether poor, whether which age group, it can clear anyone. Any mother that is pregnant is at a very high risk of developing this preeclampsia.
Excellent, excellent. I've been just learning. That's why my attention was really drawn to the myths and conceptions, because really mothers have lots of information and they can actually die because they are trying to treat something they are not able to manage. Now, we want to discuss about the real management protocol now, because now this mother has already had a fit or a seizure, but now they're in your hands. What do you often do to these mothers? Do they fully recover, or there is a reoccurrence even after the seizure, that even when they deliver, these mothers will go ahead and have high blood pressure?
So most of the mothers, if this preeclampsia is diagnosed early and they take their medication, after delivery of the baby, they tend to recover. Most of them tend to recover. They don't progress to chronic hypertension, the chronic blood pressures. So early identification saves most of those mothers.
Okay.
Cases where we identify these patients, delivery of the baby is the ultimate management plan. That these mothers are supposed to be delivered. Because we talked about, when we were starting our show, we talked about the placenta contributing to developing this preeclampsia. So when you deliver, you get this placenta out of the equation. So when the patient gets out this placenta and you only manage, you deal with the blood pressures, bring the blood pressures down, most of the times the blood pressures normalize and the patient gets fine.
Okay.
There are cases where patients progress to chronic hypertension. Those are a few cases here and there. But then complications, management of complications is quite difficult. Most of these mothers, we don't want them to get into these complications. I've told you this high blood pressure can hit the kidneys. Then a patient will end up with kidney injury that will require sometimes even changing their blood, dialysis. We have those mothers. Someone was pregnant, delivered, then they end up having dialysis done because of the pregnancy. So we don't want these complications to come because it's very hard to manage these complications. Cases where we have the brain getting involved, patient fitting, we have medication in our facilities. These days, most of the facilities have these medications, these emergency drugs, magnesium sulfate that we use in preventing those kind of fits. We use this medication alongside the medicine that lowers the blood pressures, okay, to make sure our patients recover. But if identified early, we shall institute management early enough and the patient will not end up with complications.
Okay.
So we always have to strive that information reaches our people. They turn up to health facilities when they are pregnant. They get followed up every day. They come for antenatals and they are managed before they get into complications.
Okay.
It is very expensive. It also damages the body. We can also lose patients.
Wow.
In case they get into complications.
Thank you so much, Dr. Robert. Now, should you be having any question around this very important topic, just dive on the social media platforms and go ahead and put your question, comment, opinion about the preeclampsia or the high blood pressure in pregnancy. Dr. Robert, what could be the most prevention strategies, like maybe 5 of them, that would want to explain slowly, because prevention is better than cure? I mean, even you see, healthcare is expensive. You may see it as cheap, but it is expensive to me, to other persons watching us. So we want to learn the prevention mostly, and we put emphasis on it as one way to contribute to the SDGs also.
So in our setting, patients mainly, most of the times, our mothers don't turn up for preconception kind of counseling and care.
Pregnancy lands on them.
Pregnancy, they turn up after like some months pregnant. Someone is 6 months pregnant.
Even they
That's
don't
the
know.
time. Sometimes they even don't know how many babies they are carrying. Someone is at 5 months, they don't know if they have 2 babies, 3 babies, they don't know.
Why are we still like that?
The information, and also information getting to our people. People still think that my mother delivered from the village. Nothing happened to her. Delivered 10 babies. Nothing happened. So some people are still linked to that kind of environment, okay? And they don't turn up for antenatal, okay? If we are to prevent, because I've told you, someone gets pregnant and this blood pressure, preeclampsia, tends to come after 20 weeks. So there is that gap when someone is okay without preeclampsia. If someone gets to know that they are pregnant and they get into the health facilities and they get managed, we have medication these days we use to prevent for mainly those high risk kind of patients, okay, the ones we talked about. Anyone that is high risk, we have medications we use such that they don't progress into preeclampsia. Those ones that are living already with hypertension before pregnancy, we make sure we optimize their blood pressure control during pregnancy so that they don't progress into the preeclampsia that will be so fatal for them. So all these things, all this information is available in our health facilities. People have the information. Only what we encourage our people out there is to seek for this information. Get into those health facilities. Listen to these talk shows on radios, on TVs, creating awareness about these health concerns. That's how we shall live without getting into trouble.
Excellent. Thank you so much, Dr. Robert, for running the population about prevention strategies. Now, of course, as we intensify the campaign and also speak to the public, we want to now talk about the Ministry of Health. What do you think the Ministry of Health needs to do when it comes to such awareness campaigns and, of course, high blood pressure and pregnancy? This is not new. It's been on the ground. What do you think needs to be stepped on or added on to increase the awareness?
So the Ministry of Health so far has improved in that area. There are campaigns running currently, mainly in this month of March, month of May, to create awareness about this preeclampsia. Facilities have been facilitated with the emergency medications. Magnesium. It's now very hard to find a delivery center that doesn't have magnesium sulfate. Most of those products have been provided to our people, to our health facilities, to ensure everyone gets access to proper care. Okay? The awareness about antenatal, because we talked about the prevention bit, antenatal being part of that. That is the area where we mainly institute our prevention kind of interventions. So the ministry has created those guidelines that at least all pregnant people should at least be seen by a medical personnel at least 8 visits.
Times before delivery,
Before
right?
delivery, at least 8. Okay, because some of them tend to come to the hospital after 1 month pregnant. So every month
These are
to
visits.
delivery time, at least get that visit. Okay, and anytime you get into these, you've experienced these symptoms, swelling of the feet, headaches, those abdominal pains, bleeding, you make sure you visit, even if it's not your antenatal appointment. You visit those health centers. The wasau's are there, the doctors, the nurses, the midwives are there. We just have to ensure we utilize what has been provided by the Ministry of Health.
Okay, what are you doing at Kisubi Hospital when it comes to maternal child health?
So with maternal child health, we have that center that is basically handles that. We have a full department. It handles, it's called the MCH department, maternal child health department. We have where we get to see our patients during antenatal. We have these health talks, antenatal classes. We give them antenatal classes to talk to them, to brief them about this kind of, to give them this information, to have access to this information. Okay. Then also during delivery time, we ensure the medical personnel are there to deliver them safely, and also we do that follow-up postnatal care. Because I told you that someone can develop this preeclampsia. Through the course of pregnancy, someone was okay, but after delivery, someone develops this preeclampsia. So even after delivery time, postnatal care, those first 6 weeks, we ensure these patients get those follow-up days, and we keep track of any of these concerns.
Excellent. That's amazing what you're doing at Kisubi Hospital. I think someone should prepare to come and deliver. Now we want to call upon the community, or the people who are viewing us. We want to give them the messages about preeclampsia. What should they know? The key facts.
The key facts.
Yes, about preeclampsia and what they should go home with, or what they should know and tell the other friends of theirs.
So the people out there, these are not threats. This is reality. Preeclampsia is a very serious health concern that needs your attention as the people out there. Anyone having a pregnant person, a relative, you're pregnant yourself, you're thinking of getting a baby one day, you have to have this information, okay? Such that we reduce on such cases that don't end up so well. So, our people out there, preeclampsia is very dangerous. It's a serious health concern. At times it is mainly fatal. It's very fatal. Events turn so fast when it comes to preeclampsia. So, our identification is what we have to go with. Okay? Our identification of all patients that could be developing this preeclampsia, such that we enroll them into care, we follow them up. Yeah, that's how we can improve our health system.
Excellent. Now, of course, we want to call upon the couples. You call upon the fathers.
The
Fathers
fathers.
must be contributing something to this.
Because these fathers, what they have to do, we always encourage them during antenatal. We talk to these patients, we talk to our mothers, that when you're coming back to for your next visit, ensure you come with the husband. Ensure you come with the husband. Make them also be present during this course of pregnancy, such that when we are giving this information, we give to you the information, but also the husband gets to know about this information. Now take, for instance, a mother is there with severe preeclampsia. They are convulsing. They are into eclampsia. The husband doesn't know what to do. Okay? You are alone. You're two at home. Your wife is convulsing. There is nothing you know about what is taking place. So we encourage those men out there. You have a pregnant person. You have a pregnant mother. Ensure you go with them to the hospitals when they come for these antenatal visits, such that when we are passing on the information, you also pick something and you hope to support the mothers during their course of pregnancy.
Wow. Thank you so much, Dr. Robert. Now, of course, we are intending to wrap up this very important program. And my take home personally, I've been able to know that high blood pressure in pregnancy is real, it's happening, and this is not a story, but it's the reality in the healthcare facilities. But also to note that the pressure should be between 140 over 90.
Below.
We
don't want to see the 140 or 90.
Yes.
So below, those are the normal values.
The normal values.
When you see 140, 90 and above, just know you need to see a medical personnel.
Excellent. Just give us your conclusion remarks, the points that you should not forget.
So thank you so much, Good Day TV, for giving us this opportunity to create awareness about this health burden that we're still grappling with. Then also our viewers, thank you so much for listening to us. And the administration of Kisubi Hospital, thank you so much for giving us this opportunity to visit Good Day Television and pass on the information about preeclampsia. Everyone out there, take note that preeclampsia is real. We need to address it through the examinations, early examination, early identification of all cases. Then we can help everyone that is pregnant, everyone that is giving birth.
Do you have any regards I want to send out?
My regards to people of Kisubi Hospital, mainly Mr. Prosper and Madam Ruth Namtevi. Thank you so much, everyone.
Excellent. Thank you so much, Dr. Robert. And of course, I want to once again thank you for watching Good Day TV, but also encourage you to visit our social media platforms, because this program airs every single Wednesday at 9 p.m. But it's a long-lasting program. You can go ahead and learn, get knowledge, put your comments, because we have all the time to answer and hear from your opinions. You can also suggest what you want to hear for the next program, Wednesday. I'll be here once again next week to discuss another important health issue that will change, that will impact and will improve your economy, because this is more of prevention, and we want to make sure that you prevent yourself from bigger conditions or complications, thus incurring more costs, and you'll be saving your money. I am Kamara Daniel, presenter, hoping to see you next week. May God protect you and keep you safe. We love you.
Good Day TV, transforming your life.